Good evening and welcome back to the sorry,
Hi.
Dr. Renee show. Um, Tonight we are part of the Women's Summit, so hopefully you've been enjoying the last few shows. And so today we're talking about hair loss with none other than our favorite dermatologist who's here all the time, Dr. Michelle Henry. So I'm so excited. Let's get into it. But first, share the broadcast. Everyone share, share, share. Sharing is caring. And also, let us know where you're watching from. I was typing that message in and forgot to finish it. There you go. So, and if you have questions, put them in the chat. And if I see them, I will try and get them addressed. Okay. So here we go. Thank you. And good evening.
Hi. Nice to see you.
You too. So today is all about hair loss. Can you just, well, first of all, let's tell the people who don't know who you are. Dr. Michelle Henry, as it says, founder of Skin and Aesthetic Surgery of Manhattan. It is the most beautiful place you have ever gone for any medical treatment in your life.
Thank you. Thank you. Thank you.
But what can you just really give a brief description of why you are the fabulous dermatologist that you are? Because I know you have some special qualifications.
Thank you. Thank you. Thank you. So, hi, everyone. Thank you for tuning in. So, again, I'm Dr. Michelle Henry. I'm a board certified dermatologist. I practice in Manhattan, New York. My practice is Skin and Aesthetic Surgery of Manhattan, which I founded a number of years ago. We also have a research group where we focus on specifically concerns in skin of color. And I teach the residents at Weill Cornell Medical College. I do the full range of dermatology. I'm also a skin cancer surgeon, so I do skin checks, acne, hair loss, hair transplant, skin cancer surgery, lasers, fillers, Botox, liposuction. So really diverse and really busy practice with lots of amazing, incredible patients.
Yes. So can you tell us what are the most common forms of hair loss in the Black community?
Yeah, so in the Black community, I see a ton of hair loss. There is an epidemic of hair loss. I will say my top 4 types of hair loss. 1, traction alopecia. So from pulling, tugging, braids, weaves, wigs, any sort of friction on the hair or tension on the hair can cause traction alopecia. So it's probably one of the top. Then I see CCCA, which stands for central, meaning starting at the center of the scalp. Centrifugal, which means growing from the center outwards. Cicatricial, which means scarring, and then alopecia just means hair loss. So a lot of people say I have alopecia. Alopecia itself just means there's hair loss. That's not a specific diagnosis. So this one is CCCA, so central, centrifugal, cicatricial alopecia. Then I see female pattern hair loss, which is probably the most common type of hair loss throughout the world, not just in women of color, but this is kind of an inherited sensitivity to your own male hormone, whereas CCCA is more inflammatory and kind of like your immune system is doing it. And then last, alopecia areata, which can be induced by stress. I think a lot of us have had like stress patches or stress hair loss, or illness can do it as well. But those are probably the top 4. Did I say 4? Top 4 types of hair loss I see in my office.
Awesome. So I have to ask right away, what was the first one you said?
The first one was traction hair loss.
Okay, so traction hair loss, a lot of us are very familiar with because as Black people, we wear braids and ponytails and all these things that pull our hair. Is there a coming back from that? Because I remember Renee Campbell came out with pictures years ago and talked about that's what happened to her.
Yeah, but as a cautionary tale, that if you don't treat it or you keep doing the styles that cause it, eventually your hair is going to stop. It's kind of like, I forget who made this reference, but it was a hairstylist. And she said, it's kind of like if you're mean to your boyfriend a few times, he'll come back, but eventually he's not coming back, right? So those follicles eventually are going to say, I've had enough of you. I've come back a few times. You're not listening to me. I'm tired, right? And so it can become a permanent hair loss, which is why it's so important that just because you have it once and we treat it and it comes back, don't take for granted and think that it will grow back every time.
And then the female pattern balding, is there a way to come back from that?
So there are treatments for all of these hair loss conditions. Of course, everyone doesn't respond with 100%. Sometimes we get 100%. Sometimes we get 50%. Sometimes it just doesn't budge. We know we have a better chance of it coming back if we treat it early. And so that's why it's really important not to sit on these conditions, because some of them are scarring. So like CCCA, which is that hair loss that starts in the center, can become scarring. We're much better at stopping it than bringing the hair back. So early treatment's absolutely critical. But for all of these conditions, we have treatments that can maintain them but not cure them. So there's not a cure for CCCA. There's not a cure for female pattern. There is a cure for traction, but you have to just stop styling, right? There are treatments for alopecia areata, but all of these hair loss conditions can be chronic. It's just really important to treat them early so they don't become too far gone.
So I was going to share with the audience. So this is one side of the hairline of an individual, and this is the other side of the hairline of the same person. So if someone came to your office like this, what would you do?
Well, first I would get a medical history. So every patient that comes in, we want to get a medical history. We want to hear what medications they are on. We want to hear if this has happened before, if they have a family history of hair loss, is there anything else going on? If they did not, and there was nothing we could implicate in their medical history, then I would ask, tell me about the timeline. When did it happen? Did you have itch? Did you have pain? Did you have symptoms? Were you using a new hair product? Were you having a new hairstyle? When we see discrete round patches that are completely bald like this, we start thinking about certain types of hair loss. The first that would come to mind is alopecia areata, which is that kind of stress hair loss that we get from, mental or physical stress. And physical stress can be an illness, and mental stress is, grieving, sadness, just generalized stress can cause this. If it was not due to that, then you'd want to think about things like discoid lupus, which is a kind of more autoimmune type of hair loss, which we can see patches of hair and scarring in that area. We don't see as much scarring here, but whenever we see patches of hair, that's something we have to think about. So that's kind of the direction I would go in if I saw this sort of hair loss in my patients.
So I will show you guys. This is the patient. It was me. Mm-hmm. And if you see, I have a headband. I wore headbands for, oh my God, I think it was a year, because I had these bald spots and I needed to get rid of them. And I couldn't be seen with that. You see how light it was compared to my skin color. They would stand out like, a sore thumb, especially the way I wore my hair. So I wore headbands, and that became my signature thing. But I will say that my dermatologist at the time, Dr. Colette Honore of Chicago, if somebody needs a dermatologist in Chicago, mm-hmm. she did test me for lupus. Mm-hmm. And she asked all those questions, and sure enough, she had come to the fact that it was alopecia areata. It was non-scarring. So she's like, it'll grow back. We just don't know when, but it'll grow back. And then she said, she gave me, she did a compound, and she gave me a compound that I was using to try and get it to grow back. But we figured out that the timeline was, my grandmother's died 60 days exactly apart. And Christmas, the first, because my grandma died December 10th, and then the other one died February 10th. Mm-hmm. So Christmas, there were pictures, and I was like, Mom, look, I don't think I have bald spots, right? Because I always wore my hair back like that, so you could see them if they were there. And she's like, no. And so it was like shortly thereafter. And I don't even know that I physically felt like I was stressed, but I guess it was a lot, Mm-hmm. So, and I was fairly close to both of them. So that's what we came up with. That's why it happened. And then I was just on a mission to not have to wear these headbands forever. Yeah. Because I literally had to match them with everything. And so, one of my girlfriends, shout out to Roz Emerson, she started a business actually making these clips for headbands. So I had different colored bows and flowers and stuff to clip to the headband. So then at least it looked like I had a different headband on and it would match the outfit. It was crazy. But yeah, that's what I did. And my hair was back. Like I told my mom, if I could just get a little grass so that it didn't look so light, then I could walk around without the headband. And sure enough, by the 4th of July, the year, so my grandmother died February 10th. So that same year, 4th of July, I had enough grass that I was like, okay, I feel comfortable. I can go without headband.
Yeah.
It was crazy. And it wasn't even just those patches. The shampoo girl said, do you know your hair is falling out? And I was like,
no,
and she's a shampoo girl, so I'm trying to discredit her because I'm awful. So and I'm just like, she don't know what she's talking about. My hair is fine.
You're so silly.
Look, good old Facebook. Thank you, Mark Zuckerberg. I saw pictures. It was like, Mom, my hair was like out here and it was slowly getting
Oh
smaller
my
and
gosh,
smaller
so you're
down her
just
back.
shedding.
I go, Mom, not only did I have these bald spots, but my hair literally was, it was short.
Yeah. Don't count the shampoo girl out.
She was onto something. And
You're an
I told
expert
her
in her own
after,
right.
she was
Yeah.
like, she goes, oh, I said, thank you so much. Cause I really didn't see it until I looked at pictures and was like, oh my God, she's right.
Yeah.
And then those bald spots, that was like the icing on the cake, but it really did shrink down. And that's how I knew. I was like, okay. So I'm glad, like I said, it's now people have seen I've done videos. I have hair for days now.
Good.
Thank the
Good,
Lord.
good.
But,
Gorgeous hair.
yes, underneath this lovely stomach. But yeah. But so yeah, but when it first started happening, my mom was real quick, in our family, female pattern bald. And I was like, I was not accepting that as a diagnosis for Renee Joyce. I said, ma'am, okay, there has to be something we can do about this because my grandmother, my mother's mother, I only knew the woman to wear wigs.
Yeah.
My whole growing up. So, and I'd seen her without it. So I knew she really didn't have much hair. And I was like, that's not going to be me. So we need to go to the dermatologist. I need to find somebody. We got to figure out something quick. And so, like you said, don't wait to the last minute. Don't wait and wait and wait. I didn't wait. I was like, as soon as I figured out in those pictures, I was like, let me go ask somebody. Something's wrong. So, so yeah, it's really important, you guys. For everything medical, do not wait. Waiting is not a strategy. It's not a wealth strategy either, is what I wanted to say, but it's not a strategy with your health. The earlier you find things, the quicker we can do things about it. So nutritional deficiencies, what nutritional deficiencies have you seen that have caused hair loss?
So there are many. So like one of them, vitamin D. We're often talking about how vitamin D deficient so many of us are. So I often will check vitamin D on my patients if I'm worried about hair loss. Another is vitamin B12. So when you're vitamin B12 deficient, that can also lead to hair loss. So something else to think about. People with really restrictive diets. So people who are, vegan, maybe not getting enough lean protein. Really important to make sure you're getting that lean protein. I'm seeing a lot of what I call Ozempic hair loss. So people who are aggressively losing weight, that can also cause you to lose some hair as well. Those are probably the top. When I'm checking for deficiencies in my office, that's kind of where I do focus.
So Dr. Oz did a show and talked about these are the vitamin supplements you should take if you have hair loss. And I mean, I was
zinc plays a role too,
and
zinc,
none of what you said is what he said. But go ahead.
No. Iron plays a role. I gave a short list of my top other things to think about: iron, zinc. For the luster of your hair, you want to think about those fatty acids and making sure you're getting healthy fat, salmon, walnuts, that sort of thing. Vitamin E. Those are probably the top. So you're making sure you have that lean protein. That's what makes up those amino acids in your hair. Your iron levels should be good. You're going to get thin without that. Vitamin B, B12, vitamin. It's escaping me now. What did I say initially? Vitamin B12, iron, vitamin D, and those omega fatty acids are critical.
So, what did I take? It was rose something. I can't remember what it was, but it messed with my liver enzymes. And my doctor,
oh my gosh, was it milk thistle? You have to be really careful with milk thistle. Okay.
I can't remember what it was, but my doctor called me after my annual and was like, you don't drink a lot, do you? I was like, no. And she was like, really strange. Your liver enzymes are up. Are you taking anything else? And so I mentioned these supplements. She goes, stop immediately.
That's a really good point to make. A lot of people think because it's natural, it's a supplement. Supplements can be really dangerous because it's an unregulated market, and so you don't ever know what's in the tab that someone's telling you because it's not a drug, so it's not regulated. And I see a lot of patients. I've seen that happen with milk thistle. People are doing it for a liver detox. The liver is a detoxing organ. We don't need to detox it with other things, right? It's not going to override your liver's capacity to detox itself. But I see all of these different supplements, And it can, have your physician guide your use of these supplements because it can be problematic.
Yeah. So you got to be very careful. You need to let your doctors know what you're doing just in case. And so I was eating raisins. Don't ask, but he said that would help too. So I was popping raisins every 2 minutes.
Yeah.
I was out of control.
Yeah.
But I was like, I'm desperate. I need my hair. My mother
Yeah.
said my hair is my crowning glory. I need it.
Yeah.
So I think we kind of covered the impact on the mental health of, with people and self-esteem with
Yeah.
anyone losing their hair. Yeah,
I mean, it's huge, especially for women. Your hair is such a critical part of beauty. I see patients that are more depressed in my office over hair loss than into aging and all these, because aging is normal. We all going to age. It's in many ways it's a privilege and a gift. But hair loss doesn't necessarily have to happen with aging. And so when we lose hair, people assume that we're sick, we're not healthy, we're unwell. And so there's a lot of shame around hair loss, right? We blame ourselves, we blame our eating patterns, we blame, 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 blame. And so I find that there's so much shame and blame around hair loss that it's really, really difficult for women. And it's such a big part of, we're styling it every day. It communicates so much about us. And so, yeah, there's a lot of women who show up too late for their hair treatments because they've been so ashamed for so long. They've been afraid to even come to their doctor. So you're right. It really affects mental health and mental wellness a lot.
Yeah. So please, like we said, please make sure you go and talk to somebody. If you don't have, a dermatologist, then talk to your PCP and get them to refer you to somebody so that you can definitely get in on these medical treatments. Now, can you tell us some of the treatments that you would do for somebody with the different types of hair loss?
Yeah. So, if it's just female pattern hair loss, I'm thinking about things that are going to block those hormones because that's a sensitivity to your own male hormones. So things like, maybe finasteride if you're a little bit older, DHT blockers. I may try minoxidil. Minoxidil is going to help to increase the circulation on the scalp and improve cellular turnover and get growth. If it's something like CCCA, it's inflammatory. So I'm going to use all those things, but I'm also going to put in, steroids, topical steroids, injectable steroids, oral medications that are anti-inflammatory, because that's all about reducing that inflammation. So things like CCCA are frontal fibrosing alopecia, which is also like losing a band of hair along the front, not due to traction. It's a clean cut. The immune system just makes a clean cut of hair loss. So I'm using all of those anti-inflammatory medications for that. For traction, I may inject some steroids as well. You're hearing a theme. It's all about inflammation. So when you're pulling and tugging the hair, you're creating inflammation. And so that really contributes to the hair loss. So I may use PRP, which is platelet-rich plasma. We draw the blood, we spin out those good growth factors from your blood, and we inject that into the scalp. And then if we get to a place where we can't regrow the hair, then I do hair transplant. So once we've reduced the inflammation, if it's a scarring hair loss, or we've done enough treatments that we're like, these follicles have had it, they're not coming back, then we may do a hair transplant, which, these patients are really successful with that.
Yeah, I've seen that on TV and I was like, wow.
Yeah.
That's pretty cool.
Yeah. Patients do really, really well. It's a tedious but safe and well-tolerated procedure for everyone.
And I didn't know they were using PRP. PRP they also been using for like knees and joints and stuff too. So that is really cool. But yeah, and then so what do you maybe you don't use, but I know that some people use a laser, some sort of laser treatment for hair loss.
Yeah, so there's a laser I have called the Alma-TED. And so it's using these growth factors, and the laser helps to increase the absorption of these growth factors. And so these are the growth factors that our stem cells need to proliferate and create new hair and create more robust hair and create hairs that are denser. So at PRP, we're taking your own growth factors to do that, but we don't know if you have wimpy growth factors. So using this helps you take lab-made growth factors that are specifically the ones that we want to grow some hair. And so patients come in, they have a treatment monthly for 3 months, and we're seeing really good results with that. And they're thrilled because there are no needles. So patients get exhausted from always having to have needles. Every treatment has a needle. And so this is a painless way to get those growth factors in, stimulate some more hair growth. And patients really have enjoyed it.
So I did have some steroid injections, so I completely understand. But I don't have a problem with needles; it didn't bother me. But can you and I'm thinking about people in my head. Can you do the lasers or any of that, even if the person is a senior citizen?
Yeah, anyone. It's any scalp. The lasers do not discriminate. And if you're an older person, it might be better because as you get older, and if you're a heavy drinker, heavy smoker, those sorts of things, your own personal growth factors are not going to be as effective. And so the lasers may be better for someone who is, a little bit older and may not make the highest quality growth factors.
Got it. Got it. Um, and then besides the traction, which is obviously one way to you can prevent that because so would your thing be just not to wear like if you wear braids, don't wear them too tight that you can't.
Yeah, protective styles are not always protective, right? They're only protective if you're changing them up, if you are making sure there's not too much tension, they're not too tight, that you're still taking care of your hair while you have the styles. Yeah, so and then every protective style doesn't work for everyone. If someone has very thick, very coarse hair, they may be able to maintain a style a little bit longer. Someone with very fine hair cannot, right? And so it's not a one size fits all approach for protective hairstyles.
Yeah, there was a video I just saw today, a reel that talked about how you should not wear locks forever. And everyone was like, what? And I was like, but it makes sense. They get so heavy. And I know people that have lost entire locks because they're just so heavy.
Yeah, exactly. It's just too much weight. The follicles are made to carry the weight that they're programmed to carry,
Right.
not all of the additional weight. And so that can it's damage, Like if you had to hold a 20-pound weight in your hand all day long, your rotator cuff would be ruined, right? Your arm
Right.
could not do it because it's made to carry its own weight, right? And so that's kind of what's happening. We're just damaging those follicles because they're not made to carry all of that weight.
Yeah, so you see, and that they were saying that you shouldn't wear them. You should wear them 10 years and then maybe take them out and take a break or something and try something else or cut them, but you can't,
Yeah, don't make them too heavy if we start to see hair loss. It's chronic traction when you're retightening or refreshing your locks. Make sure they don't do it too tight. Keep them a little bit looser to make sure that you're not getting too much weight per square area.
Yeah, and there's somebody in the comment here. Yes, my hair is thin out from locks, and I'm thinking about cutting my hair. Well, my locks hurt. Exactly. Yeah. And then the other thing I was thinking about was, it's wonderful. There's so many ways so many places you go get your hair braided, but you need to make sure that these people know what they're doing because all of that braiding tension when you have the wrong person in your head causes you not a good thing at all. So you need to make certain that you, because that's tension too. So you want to make certain that if you get braids, that they're not too tight.
Exactly.
You should not have to take Tylenol, Aleve, or anything after you get your hair done. You should be just fine. But some people do, and I'm like, even with the sewing, and I was like, no, my hair is never braided so tight that I'm like, oh, I have to go to bed. I have a headache.
You should be able to style your hair immediately. If you get braids, you should be able to pick them up, put them on your head immediately. If it hurts, take it out. Take it out, start over. And I feel for anyone who ever does my braids because I am really riding them the entire time. Up, too tight, take it out. Too tight, take it out. It could take all day because it's like, you make that mistake, then you're spending another year growing out this patch of hair that you didn't have to lose, right? So yeah, don't let anyone convince you that they know better for your hair. Oh, it looks fine. If you feel it, it's real, it's tight, take it out because you'll be the person dealing with that hair loss for the next year.
And also you can see those little bumps come too. Usually when it's really, really tight.
Yeah. We call that tension folliculitis, and that just means hair loss pending. So if you're seeing that tension folliculitis, absolutely we need to make sure that you take it out and that's an emergency.
Yeah, so please, 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 especially the little girls, because it can possibly be a good thing for a 3 or 4-year-old to start out with tension alopecia. I don't think so.
Absolutely not. And that happens way too often, a lot of young girls, a lot of people think they inherited their hair loss and they don't realize it's because someone, was styling their hair too aggressively. And they're like, well, all the women in my family have this hair loss. It's because everyone in the family has been doing this aggressive styling. And so you can give kids really permanent hair loss before they had a chance. So we want to be really careful with that.
Yeah. So please be careful and mindful, little boys and girls. So please.
Little boys and girls, exactly. Little boys are, having fun styling their hair and doing all these cool things now. We want to make sure that we're protecting them because everyone can really get traction alopecia.
Yeah. Well, thank you so much. This has been very informative. If you all, if you have any questions, what is your Instagram? Your Instagram is very easy. It's Dr. Michelle Henry.
Yes, it's Dr. Michelle Henry. I also do TikTok. I have a fledgling baby TikTok account, and that is Skin Doc Talks. You can find me there.
Hold on, I'm going to put it on the screen.
Yeah, Skin Doc Talks or Dr. Michelle Henry on Instagram. And I'm there to answer any questions that you have, anything that you need at all. I'm happy to address. And then, of course,
Talks with an S?
Skin Doc Talks.
Yes, okay, got it.
TOCTOKS. No, talks, like talk.
Oh,
like TikTok.
Gotcha.
Skin Doc Talks.
Okay. Yes, so please check her out there. Check her out on Instagram. She's often on Good Morning America and Today Show with wonderful tidbits of information. We're about to start summer, so I'm sure she'll be talking about sunscreen soon. And yes, Black people should wear sunscreen, right?
Indeed. Don't listen to the rumor saying no. It's for skin cancer prevention, but also to reduce accelerated aging.
Yeah. So you don't want those fine lines, ladies. We don't want crepe skin. We don't all the things.
We don't want crepey skin. We don't want melasma. We don't want sunspots. We don't want dark circles around our eyes. So we don't want hyperpigmentation on the lip. So get SPF in your lip balm. So SPF for beautification and for overall sun protection and safe skin care regimen purposes.
All righty then. Thank you, everyone. And I hope you enjoy the rest of the Women's Summit. Bye.